to be able to read the book and give voice to the incredible story. It's yeah, it meant a lot to me. So thank you, Rob, for letting me do that, mate.
Thank you.
Didn't mention me once in the whole book, not once.
Did you not? Well, well, he's mentioned me, I think, a bit.
No, he did a few times. Yeah, all good things.
Oh, thank you. Oh, that's a relief. You've met the team, and are there any questions that you would want to have?
Yeah,
for me?
so I guess let's talk about the centre. Let's talk about what you do here, and what obviously you've done for Rob, and how this centre affects and helps people's lives, people who are suffering from MND.
Yeah. So I joined Leeds Hospitals in 2011, actually, in April 11th, 2011 was my first day as a consultant.
It's a 10-year anniversary.
10-year anniversary as leading the MND Care Centre, really. And I took over the service from my predecessor, and I inherited, I think, one part-time nurse and one physiotherapist.
Wow.
And there was a dietitian and a speech and language therapist as well. So
Okay.
there were just about 4 of us. And it became quite apparent that patients who were diagnosed with motor neuron disease needed a lot of input from multidisciplinary team, and we definitely needed to expand. And I was having 1 clinic a month at that point, and that was not enough. Initially, when I saw new patients, I actually had about 15 minutes to break bad news. And then, if it was a follow-up patient that I'd inherited, or half an hour as a new patient slot, that was clearly not enough to talk about so many things. So, but the trust was very supportive, and over the last 10 years, now I've got 4 clinics a month, and we call these as disease trajectory specific clinics. So the first time I would see a patient, it would be in what we would call a new patient slot, where no other MND patients are present.
Okay.
And there is an hour available. I never see a patient without a specialist nurse being with me, so that the emotional support can be given as well at that time. And as the needs increase, the rest of the multidisciplinary team people will get involved. So now we have an occupational therapist. We were one of the earlier centers in the country to have a psychologist. We've got physiotherapists, we've got a speech and language therapist, we've got a dietitian, and I've got very good links, very established links with the gastroenterologists for assisted nutrition, and with the respiratory doctors for assisted ventilation, and again, making sure that patient safety is paramount.
They have always been really nice and friendly to me and my family.
Oh, thank you. Thank you.
I mean, I kind of, that sums it up. I mean, it's more than just the patient as well. It's the family too.
I think, everything is falling in place. The stars are aligned. This is going to happen.
Then let's make it happen.